Well, with that, Cory, just to kick it off, I'd love if you could just share a little bit about your background, how you
Yeah.
found yourself in this space with listeners. You've amassed such an incredible following on Instagram, and I know you have courses and recipes and all the good stuff, which we'll get into later. But yeah, how
Yeah.
did you find yourself in this space?
Yeah. So I have PCOS, shocker there. And I remember way back in high school, we got like one sex ed class in high school. I think it was taught by our like high school football coach. So you know how that went. Basically, we learned that we get a period every 28 days. We ovulate on day 14. Don't have sex because you'll get chlamydia and die, and that's about it. So that was the gist. And I just remember feeling and like, listening to my girlfriends talk in the locker rooms and, oh, my period's coming on Friday. Oh, mine's coming Saturday. And I just remember thinking, how do you know that? Like, that is knowledge that I have never had the pleasure of just having. And it made me feel like I was so different. It made me feel like I was, I don't know, like a freak of nature, like why wasn't I getting a period happening on a regular schedule? Why was it so random? Why would it show up and stay for, weeks, months, or just be totally gone for months? So it definitely made me feel like just very different, and I didn't understand it. And as I got older and I learned a little bit more about, like, I learned what PCOS was, and I started hearing about some of the symptoms. I was like, wow, I think that's me, And I finally had an answer to the weird, wacky period problems. Sort of. I still didn't know how to fix them. But at least I knew that there was something driving that. So when I became a dietitian, and I thought, okay, I want to open up my own private practice. The one thing I'm never going to go into is PCOS. Way, way, way too complicated, way too much going on there. Like, no. But then the more I realized, what a huge role diet and nutrition and blood sugar regulation plays in our hormones, and that whole connection in our weight. And I've been through my whole weight journey.
Hmm.
I realized, okay, here I am, a dietitian with a Master of Science degree, and I have PCOS too. Maybe I am the perfect person to step into this space and, really, really try to make a difference. And that's what I've aimed to do. And I've had the pleasure of doing now for, gosh, almost 5 years. And then some. So yeah, it's been an amazing opportunity to learn and to teach others, and along the way be able to really heal myself in ways that I never imagined I could. So it's just
I
amazing.
love that.
Yeah.
Yeah, I couldn't agree more. Again, that's why I love being in the wellness space, because I feel like everyone who specializes in something either has A, experienced it themselves, or B, has a really close family or friend who's experienced it. And again, that
Yes.
just drives your passion. And I'm very similar to you in that regard. But you
Totally.
touched on it before, Cory. So for the listeners out there who are like, what is PCOS? I've never heard of it, but I might have it. What
Yeah.
is it? And what are some symptoms of it? There are
Yeah.
many, we know.
Yes, yeah. So PCOS stands for Polycystic Ovary Syndrome. And we estimate about 10 to 15% of menstruating women have it. It is the most common endocrine, aka hormone, issue, but it's also got metabolic components and all of this stuff in the world. And it is the leading cause of infertility as well. So it impacts a lot more women than we think. And it's so complicated because it can really look different on everyone. And in order to be diagnosed, you have to meet only 2 out of 3 criteria, which means
Hmm.
that allows for that variability of symptoms, right? So the first one is if you go to the doctor, you get a pelvic ultrasound done, which means they're looking at your ovaries, your uterus, all that stuff. And they see polycystic ovaries, meaning they basically see a ton of little tiny follicles on your ovaries. These are actually not cysts. It's an interesting misnomer. These are not the same types of cysts that can rupture and cause pain. And a lot of women think, oh, I have painful periods, or I struggle with, big cysts that get enlarged and burst. I have to go to the ER. Do I have PCOS? You could have both of those going on for sure. But the tiny little follicles that we see on an ultrasound that can diagnose PCOS are not actually painful. We can't feel them. What they are little follicles which grow our eggs. basically. And what is happening, the way I describe it, is that they're all competing to ovulate, which, we basically release an egg and that then turns into either a baby or a period. And none of them are winning. That's how I describe it. So that's one way. That's one of the criteria. The second one is to have elevated androgens, which are like the most famous one, testosterone. So
Yeah.
all women have testosterone. Did you know all men make estrogen? We just typically make these things in smaller amounts, right? Men make less estrogen than women. Women make less testosterone. So in women with PCOS, for a myriad of reasons, we make more testosterone, and that can cause symptoms like facial hair loss on the head, body hair growth, acne. It can contribute to irregular periods and weight gain. So you could either have elevated testosterone or another androgen in your blood work, and you can ask your doctor to run that test, or you could have symptoms like I just described of those. And then the third one is to have irregular periods. So what does that mean? Basically, your period is not coming on a regular schedule. So typically a period will come roughly every 21 to 35 days. That's kind of the normal range. So if it's coming, 17 days and then 85 days and then 100 and then 12, that would be an irregular period. If it's not coming at all, that would be an irregular
Yeah.
period. Or if you feel like you're always constantly bleeding, that's an irregular period. All three of those things means that you're not ovulating regularly. And that is the problem when we're talking about fertility. That's why PCOS is the leading cause of infertility, because a lot of us are ovulating irregularly, or not at all. So
Yeah.
yeah, so you meet 2 out of 3 of those and you can have a PCOS diagnosis.
Is LH-FSH considered as, well, I'm curious why it's not necessarily considered as one of those three, because I remember that's something that I had tested too.
Yeah, yeah. So typically our LH to FSH ratio is off. It's like double. So it's not necessarily one of the diagnostic criteria, but it's very common. Just like AMH is, if you get your anti-malarian hormone tested and it's high, that can be an indicator of PCOS. But those haven't quite formally made it into the diagnostic criteria just yet.
Gotcha. Interesting.
Yeah.
And you mentioned that 15% of women have this. I know there's been a lot of new research, right, as to how
Yeah.
does PCOS even happen, right? And a lot of people have identified it as a metabolic issue versus
Mhm.
a genetic issue. But is there a genetic component to it? And what are some of the primary risk factors for developing it?
Yeah, so we do think there is a genetic link. We have research that shows daughters of women who have PCOS are 8 times likelier to have PCOS too.
Wow.
So, as far as other genetic links, we haven't identified those clearly, but that alone can show there's potentially a big genetic component. Risk factors, it really, I can't say for sure, because we typically get, or not get diagnosed, but we typically start to understand things are off, right around puberty and beyond. So there's not one thing that you have done to cause your PCOS or increase your risk. We don't really understand why some women have it and some don't,
Yeah.
especially if there's no genetic component going on. It's like, well, why me? We just don't know, unfortunately, yet. And that's where we definitely need more research.
And also too, Cory, I mean, we hear about these rising rates of infertility, especially among, women in their late 20s or late 30s. Is
Mhm.
PCOS a primary contributor to that? Would you say? Has there been research on that?
You know, um, not that I know of. And the fertility decline debate is messy, right? Because women are also
Very.
waiting longer to have
Yeah.
children. What's the primary indicator of infertility? It's your age, right? So we lose eggs every year, and that's just the way biology is right now. Who knows if it'll ever catch up to our lifestyle? But and then there's also talk of endocrine disruptors and how that can potentially impact fertility. So it's hard to say, but I did ask that question before several times to other people that I've had different podcasts with. Are we seeing higher rates of PCOS? Maybe. Again, it's hard to say because we're getting diagnosed more, which is a good
Right.
thing. now because we're starting to understand, oh, hey, this is an issue. There's also potentially some kind of link to body weight. We have lots of research that shows when warranted, some weight loss can help restore ovulation in women who have PCOS. So, as we tend to be in larger body sizes now than we were, 50 years ago, are we potentially seeing ramifications of that? Maybe, yes. So it's hard
Yeah.
to say. It's really hard to say.
So, speaking of more diagnoses, obviously there's
Yeah.
probably going to be more focus on treatment. And
Mhm.
for me personally, Cory, I want to say a sophomore or a junior in high
Mhm.
school when I
Mhm.
started to have more irregular cycles. And I think for me, it was more exercise induced, like
Yeah.
oligomenorrhea, that female, like the female triad syndrome, is that what they call it? Um,
Yes. Female athlete triad. Yeah.
yeah. So essentially, I think I was just over exercising. But
Yeah.
sophomore year of college, I remember experiencing a lot of the symptoms that you mentioned and did have a
Mhm.
pelvic ultrasound, had a bunch of blood work done, saw my androgens were very elevated, including my
Mhm.
testosterone. I had two of those three markers for PCOS and didn't know any better, again, which is why I wish I knew about you 15 or so
Yeah.
years ago, but didn't really know any better. And I went the conventional route, right? Which is
Yes.
basically birth
Birth
control.
control.
I tried metformin for a week. It was horrible. I got off of it. Never quite tried spironolactone because I didn't really want to take medication if I didn't absolutely have to. But I was put on birth control for 4 years before I just realized it was a band-aid solution and opted to get off of it, and was
Mhm.
actually able to reverse my symptoms on my own and kind of keep it into remission up to this point, which is awesome. But
Yes.
with that, I mean, could you just dive into, I guess, like what is the major difference between that conventional approach to PCOS, which again is often a band-aid
Yes.
solution, if you want to call it that, versus a
Right.
more holistic and integrative approach?
Yes, yeah. Thank you for wanting to dive into that because it is, it's the main thing that we learn when we go to the doctor with our we come to them with our concerns, right? And by no fault of we have incredible doctors. We PCOS is so poorly misunderstood, and they're not taught a lot about it. And so, typically, kind of the first line of defense is to help the symptoms, right? That makes sense. But no, it does not dive into and help us uncover what's driving those symptoms. So, birth control, metformin, Spiro are typically kind of first line defenses. So, if you're having irregular periods, let's have you take birth control. Let's regulate your period with birth control, which we know, doesn't truly do that. What it does is it gives us a regularly timed bleed, but it does not help our bodies ovulate on its own, which is fine, But if you are wanting to explore other options, you can absolutely make changes in your diet and your lifestyle because of that huge blood sugar regulation component.
Mm,
So, there is a very strong connection, and we have so much good, solid research about how dietary and lifestyle interventions can be effective for women with PCOS. And so that comes down to working on. So, a lot of women with PCOS have this insulin resistance component. We estimate about 70 to 80% of women are struggling with this, which can definitely put us at a higher risk for type 2 diabetes and other health complications as we get older. But it all comes down to blood sugar balance and understanding how to regulate that. It comes down to how to lower inflammation, how to work on your adrenals. There's a big adrenal component. So if someone's listening to this and they're like, well, I don't have insulin resistance, I'm not in a larger body size, I actually want to gain weight, or something like that. You could either be working on lowering your androgens like your testosterone, or you could be working on your adrenal health, which is basically how our body is responding and adapting to stressors, and working on that, because we're type A perfectionists, a lot of us, and we're go-getters, and we want everything to be perfect, and then it drives us crazy, really. So it sounds simple, but it really can be powerful, because our period can actually come back on a regular, more consistent schedule just by working on our stress. So there's a lot of different moving parts. And again, it looks so different on everyone. But I just, if you're listening to this and you're like, well, birth control is the only thing I've been offered, or I've only heard about that, that's not the only route that you can go. There's lots that you can do on the other side of things, aside from pharmaceutical medication, which definitely has its time and place for sure. But if you want to
Yeah.
explore other routes, you definitely can.
Yeah, and quick note on the birth control too. I mean, you know more than I do on this, but there's a lot of research too that's shown how birth control can harm metabolic health, which obviously is a
Mhm.
very important component for women with PCOS, as well as contribute to chronic inflammation. And I've even seen literature, Cory, and I'm curious what your take on this is, that the pill can actually worsen PCOS um,
Hmm.
symptoms. Like once you get off of it, they can kind of come back like with a
Mm,
vengeance if you're not, I guess, careful in ensuring that like your internal environment is prepped for when you do transition off the pill.
mm.
Dr. Julian Brighton has a great book, Beyond the Pill, which I read prior
Yeah.
to getting off birth control, which was so
Mhm.
helpful. But
Yes, yeah, she's great. Yeah, yeah. I think PCOS or not, your body can go a little bit wacky when you come off birth control, just as a result of your sex hormones are kind of put to sleep, right? On birth control. And so your ovulation is essentially shut down. So your hormones kind of they got to wake up again. They got to, figure themselves out. And that can take some time. So I see that all across the board in, PCOS or not. But I think a lot of us, we get on birth control when we're really young, and then we're in our early 30s, we get married, we're like, okay, we're ready to start our family, I'm going to come off birth control. And then all of a sudden, yeah, symptoms, because they've been put to sleep, just blare, right? And they come back with a vengeance. And someone is, totally missing a period. Well, how do I get pregnant if I haven't had a period in 8 months? So
yeah,
that can definitely happen. And that's where I really love to work with women to show them, here are some steps that you can take, to make that transition a lot smoother. Nothing is guaranteed. And hey, you might not even have any issues when you come off of it. But for
yeah,
those that do, it can be kind of shocking. And I always tell women who are coming off of birth control to expect the unexpected, because you just don't know, especially if you've been on it a long time. Bodies change, hormones
mhm,
change, we change so much. If you've been on birth control for 10 years, think about how things have changed in your own life so much. Your body's changed a lot. So who knows, what's going to come back, what new thing will pop up, what old thing will come flaring back, or, maybe what will continue to stay away. It's hard to say.
yeah. That's
Hmm.
so true. No, I was fortunate that I didn't really have, again, too many issues as soon as I came off of it. And it's so funny, Cory, I'll never forget when I visited my endocrinologist after coming off the pill.
Hmm.
She was very, she wasn't a fan of me coming off of it. She's like, I don't understand why you're doing this. And I basically shared with her my stance. But when I went to see her about a month or so after getting off of it, we did some hormone labs and everything appeared within normal range. And then we repeated that blood work, several months later. And she's like, I don't understand. You don't
Mm.
present as a patient with PCOS, like everything's back in range. What have you been doing? And she was
Right.
so curious. And I
Yeah.
basically was just like, oh, just some diet and lifestyle changes. But I mean,
Yes.
I'd love to get into that section with you in terms of what are steps that you advocate for in terms of a more natural approach to PCOS. I can tell you what I did.
Yeah.
It was very, not as complex as I feel like many women make it out to be, but
Hmm.
obviously focused on nutrition. So I really kind of abided by a more Mediterranean style diet. I completely cut out alcohol. Not that I was ever really a big drinker.
Hmm.
Certainly ensure like you're managing your glucose spikes. I introduced some fun supplements like peony and licorice and inositol, which
Hmm.
I know you're familiar with, to kind of again help manage your blood sugar spikes.
Hmm.
There's also some research or literature on peony and licorice serving as like an anti-androgen herbal
Oh, yeah.
supplement. So yeah, I'm curious to hear what your protocol is.
Yes, totally. Yeah. So starting with diet is, if we always talk about it, if you were looking at, PCOS as like a pyramid, right? Like the food pyramid, we go back to school, think about food pyramid. At the bottom, at the base, the very core, the foundation is what and how you're eating. And that can be the
Okay.
hardest one to tackle, right? I mean, by no fault of our own, our food society has changed so much. We've got Uber Eats and DoorDash and convenience, 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 and we're going out to lunch and we're going to happy hours, and that's just our life. So it can be the hardest one to tackle, but if you can make some changes without driving yourself crazy, and you don't have to, eliminate all these this and that, you really can make really good headway in this
Yeah.
area. And it comes down to, I talk about my PFF formula: protein, fiber, and fat. We're really highlighting those. We're emphasizing those macros, and we're eating less of carbs and sugars. Not that you have to completely eliminate those. We still need carbs, and sugar is going to be around. It's here to stay. So it's figuring out how to incorporate those foods in a way that still keeps your blood sugar nice and happy. So that's first and foremost, and that's really the most important thing that I help women to learn and to tackle.
Yeah. On
Yeah.
that note, too, Cory, I love how you said we need carbs, right?
Yes.
Can
Yeah.
you touch on why carbs are so important, especially for women? Because again, I feel like there was this whole keto train for a while, people advocating that, keto improves metabolic flexibility and reduces insulin resistance, which it does, right? But it's not necessarily something you want to be on in the long run. So can you just touch on why we should not be avoiding carbs?
Yeah. We actually have some, research on the keto diet and PCOS and how amazing it can be, which is really cool. But here's the problem: most of those studies, the attrition rate, which in research is basically how many people drop out of a particular study, are so high, like sky high, because this type of diet is so hard to maintain. What do we want to do as dietitians? We want to help people figure out how to eat and to keep eating that way. Because, you can hop on and off diet train XYZ, hop on another one, get off of it. It's a vicious cycle and it's exhausting. So we want to find something that people can, work with for life and incorporate in and continue to benefit from. So the keto diet, yes, we have cool research. I mean, it can do some cool stuff, but it is so restrictive. So
Mhm.
carbohydrates are our main energy source. So we really want to focus on carbs that give us, what I say, like more bang for our buck, which is more nutrients, right? So out of the if we're looking at a bunch of different carbohydrates, we want to pick the ones that have more benefits. And those are the more fiber containing carbohydrates. So, if you're looking at, okay, I want to do, burritos or a wrap, or, and we're looking at different tortillas, we find the ones that have more protein and fiber in them. That will help to negate a blood sugar spike that otherwise maybe a white flour product would give us. So
Right.
fiber containing carbs are important, and we want to eat them along with some protein. So carbs should be eaten with protein and fiber, because that really helps to keep blood sugars happy, while still absorbing the benefits of that particular carbohydrate, and especially when we're talking about energy levels, we need them. We really do need them, and we want to pick the ones that are most helpful for us. So,
Yeah.
looking at the PCOS diet, in a way that says, okay, I'm going to try eliminating all gluten, dairy, soy, and sugar. Good luck, because that's an unrealistic way to look at how I'm going to be eating for the rest of my life. So we want to pick something that's more sustainable.
Yeah.
Um,
Who is it? Someone said if you can't follow a diet for 10 days, or yeah, if you can't follow a diet for 10 days, don't expect to follow it for 10 years. And I think that's a
yeah,
really great
very
proxy to
true.
live by.
Definitely. Yeah, definitely. Yeah. So, so diet is first and foremost. That's number one. And then the second little block on that pyramid up above from the dietary changes is movement. I find there's so much fear mongering about workouts for PCOS. What can
Hmm.
we do? What can we not do? And what it does is it terrifies women into thinking that they can't move their bodies, and they
Right.
think they're going to spike their cortisol too high. And so they end up being sedentary. There's a nice balance, right? I don't need someone to go be, nor do I really want them to go be an Olympic athlete just because you have PCOS, but don't be completely sedentary either. Humans are meant to move. We're not meant to be doing what we're doing right now, sitting behind a
Right.
screen. So
I
even if you're
know.
just walking, even if you're, anyways, pick something that you like. Keep consistent with it. Exercise is always going to be beneficial as long as you're not overdoing it for your metabolic health, which, yes, we are at an increased risk for, heart disease, stroke, of course, type 2 diabetes. Exercise can help regulate blood sugar. So find something that you enjoy and do it as regularly as you can. So exercise is important. Stress management is the other one. Your adrenals. we have certain androgens that we make mostly in our adrenal glands, not our ovaries, like DHEA. So we really want to be paying attention to the state of how we are handling stress, right? And really paying attention to our stress response system. Self-care, all that woo-woo stuff is so real because we just the way that our society is set up right now, it's so, so busy, so hectic, so
Yeah.
stressful. And paying attention to your stress levels is only going to benefit your hormones, and especially PCOS, especially if you've got that elevated DHEAS that you get, back on lab
Yeah.
work.
So
Mm-hmm.
true. My body is very sensitive to stress, and there's been times where I went through a stressful event and lost my cycle for like 6 or 7 months. So
Yes.
again, everyone is different, but I've realized that I'm very sensitive to stress. And speaking of
Yes.
stress sensitivity, going back to exercise, you made a great point. I think a lot of women get paralyzed in terms of thinking, what is the most optimal exercise to do, and then don't exercise at all. But with that said, Cory,
Mm-hmm.
ideally, what is like the best type of exercise for women with PCOS? I mean, I know strength training improves insulin resistance and metabolic flexibility.
Mm-hmm.
I used to be one of those, I'm going to run 6 miles on the treadmill back in college every day and burn my adrenals out, which
Mm-hmm.
hindsight's 2020, but that probably wasn't the best for someone with PCOS. But what is
Yes.
like the quote unquote exercise we should be striving for?
The best exercise for PCOS is the one that you enjoy. It's the one that you're going to get your butt to go do because you like it and it feels good and it's good for your mental health and it doesn't burn you out. You can do strength training, you can do cardio, you can do more restorative workouts, which would be like hiking, slow biking, yoga, walking, gentle Pilates. You can do all of these. I love a combo. I love a combo of all three. Get some strength training in there a couple days a week. Get some cardio in there a couple days a week, especially if you're working on weight loss. Cardio and strength training are excellent tools for that. And then get that restorative workout in too, because
Yeah.
that's going to benefit your mental health and your adrenals. And yes, if you are someone who is prone to hypothalamic amenorrhea, which is what basically you're talking about when we are kind of overdoing it in the exercise department, underdoing it in the food eating department, or either both of those or one of those, you definitely want to pay attention to how much you're exercising and your stress levels because your body is just more sensitive.
Yeah.
And I speak from personal experience with that too. You can have both PCOS and hypothalamic amenorrhea, which is
Mm-hmm.
basically when you lose your period because your body is kind of in this super stress state.
Yeah, that was me for quite a while.
Yes.
Speaking of stress, we
Yeah.
obviously in this age of biohacking, right? We hear a lot
Mhm.
about hormetic stressors, which for listeners are basically things that cause short-term stress on the body, right? But that can often have long-term benefits, things like fasting, cold showers, things like
Mhm.
that. For a woman with PCOS who already kind of has a lower stress threshold, what are
Yes.
your thoughts on participating in some of those types of practices?
That help reduce stress.
Yes, that
Oh,
that actually like increase stress like short term, but
oh,
have
oh,
prolonged benefit. Like yeah, like cold showers, for example.
oh, I see. Yeah. I mean, if they're helpful for you, do them. I can't tell you, I can cite, 10 different scientific pieces of different literature that will tell you that you must do this if you have PCOS because it's going to be an absolute game changer. I think everyone's different. We all
Yeah.
have to twirl around different ideas and figure out what works best for us. But if that's helpful for you, awesome. I remember meeting with a coach she was all about anxiety and lowering anxiety. And one of the things she said that was great for getting yourself out of an anxious state, she was actually a guest on my podcast a while ago, was to do a really cold shower. That doesn't work for
Hmm.
me. I hate being cold. It makes me anxious thinking about getting in a cold shower. So I was like, that's awesome that it works for people. That's not going to work for me. So I think we just have to fiddle around with what resonates most with us. You don't have to go do all of the things, but test things
Yeah.
out and see what works best for you.
Yeah, that makes sense. I'm
Mhm.
sure you might have a similar response, but what about time restricted eating?
Like intermittent fasting?
Essentially, yeah.
Yeah. So I know there are some people who it works great for. If you are prone to blood sugar dysregulation, if you are working on fertility, If you're, someone who's insulin resistant, I don't recommend it because our sex hormones want to feel safe enough to flow. And if they don't know when their next meal is coming from, and our blood sugar drops significantly, and then it spikes when we eat a ton of food, and then it drops.
Mm-hmm.
The goal is to really keep our blood sugar steady, Eddie. We want that stability. That's
Yeah.
what makes our hormones happy, especially when it comes to androgens. When our blood sugar is all over the map, for PCOS, it sends messages down to our ovaries to pump out more testosterone. That's exactly what we don't want.
Right.
So I always recommend to get in regular meals and snacks, high protein snacks. Keep your blood sugar stable as possible to avoid those big kind of peaks and valleys. We have people who are like, I have done intermittent fasting and nothing else works for me. Am I going to tell you that that's wrong? Absolutely not. Like, do that. But the majority of research that we have, and from my experience doing this for many, many years, I see the best results when we actually do the opposite, when we're focusing on regular meals and snack times from a blood
Yeah.
sugar standpoint.
And what
Mhm.
does that look like too, Cory? Like, because I know
Yeah.
there's some people who might be eating every like hour on the dot, which also isn't good. So what's a proper like allotted amount of time between meals or
Yeah.
snacks?
Yeah, I typically recommend 3 meals and 2 high protein snacks a day. So if you want to do, breakfast and then lunch and then dinner and have your like afternoon snack and then after dinner snack, or you could do a, AM and a PM snack. There's not one time that, as far as duration, then I'm like, do not go over. But typically we want to be having something, at least every 4 to 5 hours. We don't want to go
Yeah.
these like big, long, like 6, 7, 8 hour time chunks, which I see all the time when women we're too busy to eat. I don't even know what that's like. I have to eat all the time. But I'm always thinking about food. But
Same.
like, oh, I forgot to eat. I'm like, what? No, but we don't want to go that long. We want to keep our blood sugar stable. So there's not one clear, number I can toss out there, but just don't go all day without eating. Come home and have a gigantic meal. Go to bed stuffed. Have it interrupt your sleep. Wake up
Mm-hmm.
not hungry as a result, and start the cycle all over again. And
Yeah.
have coffee until noon.
That
That's
used to
what I
be
see
me.
all the time. Yeah, you're not alone. I see that all the time. And it's so funny. Even when I work with clients one-on-one for months, it's like the hardest cycle to break. So if that's you, that is one thing that you can change to really set your blood sugar off on the right foot is get up in the morning, have a breakfast that includes protein, and here's the magical one that everybody forgets, fiber. Both of
Yeah.
those things in the morning are going to put your blood sugar in a happy state all day long. You're going to have better energy. You're going to have better mood. You're not going to have that afternoon crash. You can still have
Mm-hmm.
your coffee or your caffeine, but wait a little bit until you eat, after you eat.
Yep.
If you make that change and stop making dinner your most gigantic meal, you're going to wake up hungry. Because a lot of people say, well, I wake up and I'm not hungry. I don't
So
want to
true.
eat, or I'm nauseous or something. Like, well, how much did you eat the
Yeah.
night before at dinner time, right? If we pare that down and wake up hungry, we want to wake up hungry. That's a good thing.
So true. Yeah.
Yeah. So,
Honestly, you're gonna laugh. I like look forward now to waking up in the
mhm,
morning, like rather than wanting to hit snooze because I am hungry and I do want to eat
yes,
breakfast, right? Because
totally.
again, I used to be in the cycle of,
Yeah.
not eating until like 11:30 in the morning. I'd have coffee on an empty stomach, which is the worst thing to do. It spikes your blood sugar. And then,
Yeah.
yeah, I'd be thinking, oh, I'm intermittent fasting. I'm going to have my first meal at 12 o'clock. And then when
Yes.
4 o'clock rolls around, it's like you're also starving. And then you
Yes.
just binge eat and you feel horrible about yourself. And it's just this
Yes.
really vicious cycle.
Yes.
So, again, that's a really, simple hack that a lot of women can make that I'm sure makes a really big difference. But what
Yes.
are some other, I guess, like resources you give to women who are in that repetitive cycle? And you
Mhm.
alluded to it before, but I feel like a lot of women with PCOS do have that
Yes.
perfectionist type A personality, and it might be more
Mhm.
challenging, right, to get out of those cycles that are so ingrained. So, how do they do that?
Yeah. Well, I want to go back quickly and just, revisit this binge, restricting binging kind of cycle because I really want to eliminate the shame from that, because we can feel so shameful over that, but it really is a natural physiological response. If you're not giving your body regular fuel, and you're starving, but you've kind of muted that feeling because you're not paying
Mm-hmm.
attention, by no fault of your own. You haven't trained your brain to do that yet, to your hunger signals. And then you go completely overboard. And then we feel this intense guilt and shame around that. And then we're like, well, why can't I lose weight? Or why can't I, feel and look the way that I want to look? Let's
Yeah.
strip all the guilt and shame from that, because the problem is not you or your willpower. That's false. The problem is that your body needs fuel and it's overcompensating, right? So by giving your body that regular fuel source, even if it feels like you're eating more often, you
Yeah.
will train your body. You will not have such intense cravings or urges to go overboard, because your body doesn't feel like it needs it anymore. So
Exactly.
it's a training. I train my clients and my program members to really get into this new zone. And that's where the magic happens, because all of a sudden we realize, okay, wow, I'm much more in control than I thought. And also, when we have this blood sugar dysregulation component, which going long stretches of time without eating exacerbates, it intensifies our cravings. We talk
Yeah.
about fatigue. Women with PCOS, we talk a lot about cravings and fatigue, and that's because of that insulin piece, that blood sugar piece. So by tackling that, you can help to mitigate your cravings, turn down the volume knob, and also boost your energy levels, your mood, your libido. So you feel like a totally different person. So if you're incorporating these things in, if you're listening to this and you're like, well, that's me, you're not stuck there forever. We just have to tweak how your blood sugar is behaving. And that's the
Yeah.
key. That is the key to unlocking that. So, yeah, there's a lot of, I think PCOS plays mind games with us. We feel like we're so powerless. We feel like we're not in control of these urges and these thoughts and these feelings that we're having, but we're a lot more in control than we think. We just have to get the tools to climb
Yeah.
into the driver's seat and say, I'm the boss now, and here's how
So
it's going to
true.
go. And,
Yeah.
that's where I love to help women to understand what tools to give them. What do they need to know in order to tackle that and regain that power?
Yeah.
So it's a process, but
No,
it
I
can
love that.
absolutely be
I
done.
love that. And we know, Cory, that symptoms can go obviously into remission. Like I'm exhibit
Yeah.
A, but could you say that, PCOS is also kind of classified as it's a metabolic disorder and it's like a chronic
Mhm,
disease in some cases.
mhm, mhm.
So could you say that someone could actually completely heal from PCOS, or is it more of like this underlying thing that we're always going to have, but we can manage symptoms, through diet and lifestyle and everything we've been discussing?
The second. So you'll see, that's a big red flag if you see an influencer on social media claiming, I cured my PCOS, it's gone. I'll cure yours too. Well, think about what they've done to get there and what they continuously do, right? That social media influencer is not, sitting on the couch eating, pirate's booty, watching Island all day long, right? They're exercising, they're making their protein packed smoothies, they're doing all the things. They're managing their PCOS really well. And so PCOS, there is no cure, but don't let that frustrate you, right? Or, cause doom and gloom. It just means that it's something we have to continuously manage. But it's a lot easier to manage once you have tackled those initial fronts: diet, movement. We didn't get into supplements, but taking the right supplements and understanding what your body needs. You
Yeah.
can keep your symptoms in remission, and that might look like it's cured. But if you were to stop doing those things, right? If you were to go back to eating, skipping breakfast, having coffee, nothing until 4 p.m., binging, going to sleep, getting crappy sleep, waking up stressed about it, totally
Yeah.
falling off your supplement routine, what's going to happen? Your
Yeah.
PCOS symptoms are going to come rolling right back. So there is
Yeah.
no cure, but as long as we can stay on top of these things, and I'll tell you now, for having PCOS since puberty, basically, and now being in such a good place with it, it's not so overwhelming now as it was initially. There are little things that I do still, but it's not this life-changing thing as it once was when I first started to tackle it. So
Yeah.
let that, give hope to women who are like, oh my gosh, but I'm so overwhelmed. It's normal to feel overwhelmed at first. But once you have those tools and you understand your unique PCOS and your body and what it needs, it's so much easier to manage.
Yeah,
So
that makes
big red
sense.
flag, anyone who claims to cure it is not true.
No, that makes complete
Yeah.
sense. I am curious too, Cory. Do you know what the average age of women who are diagnosed, officially diagnosed with PCOS is?
I don't. That's a good question. I would think it's not right at puberty, right?
Yeah,
Because things are kind of crazy for even women who don't have PCOS. Periods can be wacky the first couple years, which is why I
right,
don't love a PCOS diagnosis at age 13. I don't love that.
right. Yeah,
I would say mostly in early mid 20s, I would say. And
yeah,
also as women, start to think about family, having a family, getting off birth control, we see that a lot. We get off birth control, in our late 20s, early 30s, and then boom, we get a PCOS diagnosis because, oh my gosh, like all of this stuff that I totally forgot was happening has come back as I've come off
yeah.
birth control. Not because of the birth control, but because birth control has been masking it. Hmm.
Yeah, no, that makes complete sense. You touched on it before. I did want to get into supplements with you
Yeah.
because again, I that those are really helpful for me in my healing journey. But what are the
Yes.
top supplements that you like to have clients use?
Totally. So I would say a huge one, and the most the I have my own line, and the top seller, the one that flies off the shelves every single time, is a blend that helps to support lower androgen levels, right? So like
Hmm.
testosterone, because that's so crucial for so many of us, and it can cause so many of our symptoms. Taking something that can help lower those androgens and support that process. Spearmint tea is not a pill
Hmm.
supplement, but it is actually, we have a ton of great research about spearmint tea, 2 to 3 cups a day, not peppermint,
Yeah,
y'all, spearmint.
difference.
Drinking that drinking that a couple times a day. You can have it hot, you can have it iced in the summer, along with an androgen blocker supplement like the one that I make. That there's different blends out there, but can be really helpful and help to attack things like, get down that facial hair growth, acne, help regulate your period. So that's a big one. And there's a reason why it's constantly flying off the shelves, in my own business and for others. Inositol is
Yeah.
probably the best known PCOS supplement. You want to find it in the correct ratio, which is 40-to-1 ratio of myo to D-chiro inositol. And that is so great for blood sugar regulation. It's great for helping to support lower androgens. And if you're trying to conceive or thinking about babies in the future, it's actually really great for egg quality. And actually, men can
Interesting.
for sperm
I
production as
didn't
well.
know that. What are
Yeah.
your thoughts on like inositol versus berberine? Because that's
Yeah.
another one we hear a lot about. And is there a benefit to one over the other?
Berberine is great too. Berberine and inositol both kind of do the same thing in terms of the blood sugar balance. I have seen in my clinical practice much better results with inositol than berberine. But if someone doesn't react well to inositol, some people can have some digestive complaints. It's not as much as metformin, most certainly
Yeah,
not. But some people can still have some complaints, and that's when I would switch them to berberine.
gotcha.
So I've seen better results with inositol, which is why I recommend it, why I make it. But yeah, both can be good. Hmm.
Yeah, I love that.
Yeah.
Yeah. Another thing I included was saw palmetto. I have to look at your line and see which different herbs you
Yes.
use because I'm really curious about your mixes. But yeah, saw palmetto, peony and licorice, spearmint tea,
Mhm.
chaseberry. Like, and there
Yeah.
was an element where I was just experimenting with things on my own because I wasn't necessarily working with someone, which I do
Mhm.
encourage patients to work with someone. So it was more of like a test and trial run for me, but I learned a lot through that.
That's
And
awesome.
yeah, it is very frustrating. I remember just being in college thinking, why is my face breaking out so much? I'm not 13 or 14 years old anymore, but you have to realize what's going on underneath. And the dermatologist can only do so much with
Mm.
their steroid recommendations, which also it's a whole other story, but not really good for you.
Yeah.
But when you
Accutane.
really address, go ahead.
Accutane. Can't remember.
Accutane, yeah, exactly. I know, and it's just really crazy because again, it's just all band-aid solutions while not really addressing the root of what's going on. But yeah,
Mhm.
spearmint tea, eating
So true.
breakfast in the morning, like simple steps that women can take that really do have huge effects.
Yes, yeah. And I think with supplements too, I get asked all the time, what supplement can I take for XYZ, right? And supplements, if you think about that pyramid that I mentioned earlier, diet
Yeah.
at the bottom, the foundation, the biggest part, movement, stress, gut health, and then supplements is at the very top in the little triangle. Women want to
Teeny
reach the
tiny.
bottom up and get the supplement and ignore all the other steps of the pyramid. You've
Yeah.
got to build on the others, and supplements are at the top. Supplements are supportive of dietary and lifestyle changes for PCOS. So if all you want to do is take a supplement, that is not going to fix all of your problems. You need
Yeah.
to incorporate the other steps too. So
So
don't
true.
start with the supplement, start with other changes and then add supplements in that are supportive and helpful.
Yeah,
Mhm.
I love that. And one other thing too, Cory, I wanted you to touch on because it is so important because they're so prevalent today is
Yeah.
endocrine disruptors,
Yeah.
right? So things that are found, and we know, I forget, there was a stat, it was like women put over like 100 different things on their bodies every single day, from makeup to deodorant to the shampoo they use. And it was just so overwhelming. And
Yes.
I understand, right, that like people like, you can follow some health influencer and they're basically saying you can't put anything on your skin. And I think there's a fine line, right? But can you just elaborate on maybe what are some like top things we should really be actively avoiding in, again, skincare products, deodorant,
Mhm.
etc.?
Yeah, this is such a huge wide world. And I will be the first to say that it's something that you can easily drive yourself nuts over, right?
Yeah.
Because we live in, I mean, we sleep in plastic. Literally our sheets are polyester. We're sleeping in plastic. So to try to make changes is so difficult unless you're like living off the grid, making your own shoes. That's not most of us. So I think we have to be realistic about what and we all have our own comfort levels, right?
Yeah.
Like I'm okay with adding in blank 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 in my food. My best friend is not. We have to figure out what is important to us and just do the best we can. We can't be perfect. We can't eliminate every single synthetic thing that we hear about on the news or social media
Yeah.
that this is toxic. And it's sad because, who I don't know. We see cancer rates rising in younger people and we wonder why. I don't know exactly, but we theorize that, endocrine disruptors and our food could potentially be key players. But it's like, okay, well, what do we do with that information? So
Mm-hmm.
that was long-winded, but it's hard. It's a big can of worms. I don't want to open it up and go into all these different areas, but I think it's about number one, figuring out what are our comfort levels, right? Like, where do we fall on the spectrum? We're all on a spectrum as far as what we're willing to accept and use in our everyday lives and what we're not. Get clear on what that means for you and be okay with that and understand that you're not going to be perfect. What we really talk about and I talk about in my programs are like when it comes to personal care products like fragrance,
Mm-hmm.
phthalates, parabens, sulfates. These are things that you can avoid and are becoming easier to avoid because brands are being more transparent about when they're adding them, when they're not. So if you look at the bottle of shampoo that you're using, right, and it says no sulfates, no parabens, the phthalates and the parabens are basically two fragrances that are added into a lot of stuff. We can at least feel comfortable there, so you're not having to look every single thing up. There's apps that can help you. Think Dirty is one that a lot of people use that you can check different ingredient lists, check different brands, where do they fall on that like clean beauty spectrum. So I would recommend using that just as you're shopping around. Like if you go to Target, whip out your phone and if you're looking at
I
something,
love that. I
type
haven't
it in.
heard of that one. I've heard of
Yeah.
the EWG app, but I haven't heard of the Think Dirty. I have to
Yes.
check that out.
EWG has the Skin Deep system that you can use. Type in an ingredient, type in a brand. It basically gives it a grade. So you
Yeah.
can definitely be a conscious shopper, and a lot of that work has been done for you by people that have, given it that rating. So that's mostly what we talk about in terms of food. It's so controversial. It's so conflicting, like
Mm-hmm.
seed oils and,
I know.
aspartame, and it's just really hard. And I always say, you don't need to go and say, I will never have another, Diet Coke in the rest of my life. It's fine if you want to do that. But, don't drink it every day. Figure out a balance to where you can feel comfortable, but still once in a while indulge in that thing, So figure out where you are in the spectrum and be
Yeah.
comfortable with that.
I
Live
love
like
that. That's so true. Honestly, Cory, I feel like the common theme in this whole conversation is do what's best for you.
yeah.
And that's really so important because I was chatting with
Mhm.
my mom the other day and I was like, I just feel like the more immersed you become in the wellness space, and like you and I are on it every day with Instagram and all of our Instagram friends and everything, it's so overwhelming because there's constantly new research and new things coming out. People are saying, do this or do that, and like
Yeah.
dietary changes. And like,
Yeah.
honestly, it's overwhelming, and I think the stress it creates is
Yeah.
worse than the thing itself. And it's
Ugh.
so funny. Are you familiar with Emily Morrow? She has this Instagram account called Really Very Crunchy.
No, I don't think I
You have
follow.
to check her out. You
Okay.
would really appreciate her account. It's hysterical. But she
Okay.
basically like she uses satire and creates all of
Mhm.
these really funny videos on like the quintessential crunchy mom.
Laugh.
And
Perfect.
some of them are just like so spot on. Like there's one video where she's outside walking with her two kids and all of a sudden she smells like fabric softener from the lady next door. And she's like, kids, like, pull up your shirts, don't breathe, run to the house. And it's just so funny, but it's so true because
Yeah.
that would be my reaction too. But
Uh-huh.
again, the stress over whatever it is you're worrying about is
Yeah.
worse than the thing itself. But she was telling me, I think it was her husband Jason's grandma is like in her mid 90s and
Mhm.
she literally microwaves like styrofoam. And like Emily would go over and be like, you really, yeah, like
She's
you really shouldn't be doing this. But she's like, and she's like, who's 95? But like
yeah.
the point is that,
Yeah.
there's people who live to like their hundreds, not ever
Mhm.
knowing about organic food or all of these
Mhm.
things that you and I are sitting here talking about, and they live
It's so
long and healthy lives. So like I think there's a balance, and again, the more I get into this space, the more I realize like it's not all about doing what everyone says is right to do. It's about doing what's intuitive and what you think is best for you, right? And having that balance.
I so agree. I so agree. And the older I get and now that I'm a mom, I find that it's definitely a balance. Do what you can. Don't drive yourself crazy. Genes, genetics are a lot stronger than we think, but there's still room to change and make improvements. But yeah, there's so much to say in that whole discussion, and it's a big wide world, and there are people that are much more well versed in it than I am. I'm more on the food side of things, obviously, but
Yeah.
yeah, make sure who you're getting advice from on social media is somebody, who is a credible source, who has a degree, a license, who's qualified to speak on that issue, because there are a lot of people operating on social media who have great, fancy, beautiful accounts, and they're beautiful. And, but do they have the qualifications to really be speaking, behind this? This really comes down to science. It always comes down to science with anything in the wellness space. So make sure that they're legitimate, qualified providers, and, they're giving correct advice, because otherwise you're going to be led down 85 different rabbit holes just before 9 a.m. about, whatever.
Yep.
There's a lot of different things. So, yeah, just make sure whoever you're following and you're listening to and you're actually absorbing information from is legitimate, because that matters. People are like, well,
Yeah.
just because you have a degree, it's like, well, I mean, yeah, I wouldn't want a plumber performing my open heart surgery. People are get qualifications for a reason. So, let us do our jobs. And, anyway, yeah,
Yeah.
a lot out there.
Love that. Speaking of following, where can
Yes.
listeners find you on
Yeah.
social, your courses, your website, all of that fun stuff?
Yeah. So my Instagram, TikTok, YouTube handle is all the same. So is my website. It's the Women's Dietitian. So I'm probably most active on Instagram. And then I have my 2 programs. I have the PCOS Boss Academy, and then I have Get Pregnant with PCOS. I run both of those several times a year. I love them. They're so
That's
fun.
awesome.
They're so informative. They're so popular. They sell out very fast, but I love to run them. And that's really where I'm able to work with women to give them, the foundation and the tool set to really tackle this diagnosis well. And then I have my supplement line, which is Vita PCOS, and I have my, androgen blocker. I make an inositol. I have a cortisol calmer, all kinds of stuff for healthy periods. It's a cool
Awesome.
line. I have that. Yeah, I have a book on PCOS coming out next year, and I'm very
So
excited about it. I
exciting.
haven't really talked much about it because it's just entering like finding the right publisher phase. This is a huge process. Writing a
I'm
book is
sure.
a huge process. Even after it's written, it's like a year and some change before you even can get it out there. But
Yeah.
very excited about that. And then I am going to be opening up a multi-practitioner practice where I can basically provide one-on-one services again under people working underneath me. So they
That's
will basically
awesome.
have my brain on and can help, women in a one-on-one setting, which is very, very cool. And then I have
Oh my
another
goodness.
program coming out, but I won't talk about it yet, but it's very exciting. And then I can't wait to launch that. So yeah. And
Oh
I'm
my
not even
gosh.
pregnant, so I have my third baby due in 2.5 weeks.
I
So
didn't know that.
yes, yeah.
Oh my
Mhm.
gosh, congratulations.
Oh, yes.
Wow, look at you're super mom doing all of these
I'm
things.
getting here.
Oh my
Yeah.
gosh, congratulations on all of that. And yeah, super exciting about your book as well. I'll have to have you back on right before that goes live.
Yes, it's going to be awesome. It's so needed. It's so needed out there.
I'm
Yeah.
sure. Cory,
Yeah.
this has been so much fun. I'm so glad I finally got to actually meet you. I look forward to having you back on. But my last question for you, and this is my favorite one to ask, and
Okay.
that is, what does being well and strong mean to you?
That's a good question. Of course, it goes along with the theme. What is well and strong? I think I think um, in my early 20s, I would have answered this very differently than I will in my mid 30s. I think well and strong to me now is more about mental health than physical strength. And that mental health, being able to govern whether or not you can go on to work on your physical self, work on your physical health goals. If you feel well enough, capable enough, strong enough mentally, your anxiety, depression, whatever it is in check and in a really good place. You have the capacity and the bandwidth to be able to work on other pieces of your health. So I think that mental health part is just so key, and something that I have prioritized more as I have gotten older, and now that I'm a mom of almost three, and really prioritizing that and putting that at the focus of making sure I'm good there so that I can take care of everything else, my family, my relationships, my business. So that's probably how I
I love
answer
that. Beautiful. Yeah, I couldn't agree more. It'll be interesting to see how that changes for you 10 years from now, too.
Yeah, totally. I know,
Awesome.
definitely. We'll see. Time will tell.
We'll see. I have to have you back on. Well, Cory,
Yeah,
thank you so much again. Super excited to share this with listeners. And yeah, I hope to have you on again at some point soon.
awesome. That sounds great.